This video contains a truth that has changed the lives of many people. If you are having health problems and have ever felt stuck, please subscribe to the channel and leave a comment in the comment section so we can share useful knowledge together. Have you ever noticed a strange tickle in your throat that just won't go away? Or maybe a stuffy nose that seems to linger even when it's not allergy season? Most of us brush these things off. I'm just getting older, we tell ourselves. It's probably nothing. But what if it is something? I've been in healthcare for over 30 years now, and I can't count how many times I've seen someone ignore subtle signs, not out of fear, but because they just didn't think it mattered. They thought it was minor, manageable, a nuisance. But in some cases, those small signs were trying to say something big. That's why today, we're talking about something that's often missed but incredibly important, especially for people in their 60s and beyond: the early warning signs of nasopharyngeal cancer. Now, I know, that's a mouthful. Nasopharyngeal cancer sounds like something out of a textbook. But here's the truth. It's a rare type of cancer that starts in the upper part of your throat, right behind the nose. And while it doesn't get the same attention as breast or colon cancer, it shouldn't be ignored. Because when caught early, it can be treated, and treated well. But when it's missed, it can creep into places we don't want it to go. And here's the tricky part. Nasopharyngeal cancer doesn't always scream for attention. It doesn't always come in like a wrecking ball. Sometimes it whispers. So today, I want to walk with you, side by side, through 7 signs that might seem small on their own, but could be the body's way of saying, please listen to me. Let's start with one of the most common, and also the easiest to overlook: persistent nasal congestion or stuffiness, especially on one side. You might think it's just a cold or allergies, but if that stuffy feeling doesn't go away after a few weeks, and especially if it's more noticeable on one side than the other, that's worth paying attention to. The area behind the nose where this cancer can begin can easily get blocked. If a tumor starts forming there, it can obstruct airflow, leading to a sense of fullness or blockage that just lingers. I remember one patient, let's call him Richard, who came in complaining about a clogged nostril that had lasted for almost 2 months. He thought it was allergies. His wife thought it was a deviated septum, but a quick look and some follow-up tests revealed something deeper. And because they didn't ignore it, we were able to catch it early. That decision may have saved his life. The second warning sign is frequent ear fullness or hearing loss again, especially on one side. Now, you might be thinking, well, of course my hearing isn't what it used to be. I'm in my 70s. And you're right, hearing does change with age. But this is different. If one ear suddenly feels clogged, muffled, or like there's pressure behind it, and it doesn't clear up with time or a change in elevation, that could be a red flag. See, the nasopharynx, that area behind the nose, is connected to the ears through something called the eustachian tubes. If a tumor begins pressing on that area, it can block the tube, leading to that plugged up, underwater feeling. In fact, in early stages, some people are even misdiagnosed with chronic ear infections or fluid in the ear. That's why if you or someone you love starts saying, my ear just feels funny, like I'm on an airplane all the time, don't brush it off. Talk to your doctor. Ask for a deeper look. Now, I want to take a moment here to pause and say this. Not every stuffy nose or blocked ear means cank. But if something is lingering or just doesn't feel right, your body deserves your attention. That's not being paranoid. That's being proactive. Moving on to a third sign that people often miss: a painless lump in the neck. Now, this one's sneaky. Why? Because it doesn't hurt. And because it doesn't hurt, people assume it's harmless. But a swollen lymph node that sticks around, especially on the side of the neck, can be one of the first signs that nasopharyngeal cancer has spread. You might notice it when you're shaving or putting on lotion. It might feel like a small, firm bump under the skin, not tender, not red, just there. If that lump stays for more than 2 or 3 weeks, please don't ignore it. In many cases, these swollen nodes are the first visible signs of something deeper going on inside. I know this part might be uncomfortable to hear. No one likes to think about cancer, especially the kind that hides behind a common cold or a mild earache. But let me tell you something important. You are not powerless. The earlier we catch something, the more options you have. The more life you have to live, love, and enjoy. So let me ask you, have you noticed anything off lately? A nose that just won't clear up? A strange sensation in one ear? A bump in the neck that wasn't there before? If so, don't wait. Don't Google it for days, hoping it goes away. Trust your instincts. Trust your body. And most importantly, trust that you deserve answers. And I want you to know, you're not alone in this. If you've had any of these symptoms, or if you've been feeling like something just isn't quite right, I encourage you to share in the comments. Tell me what you're going through. Let's talk about it. Whether it's a question, a fear, or even just a strange sensation you've been ignoring, I'm here. And so are others who've been through the same thing. Because sometimes, healing starts with a conversation. Now that we've explored these early warning signs, the nasal congestion that won't quit, the ear that feels oddly full, and the neck lump that just doesn't belong, let's keep going. There are still a few more signs that deserve your attention. Now, we've already talked about how things like a stuffy nose, a plugged ear, or a lump in the neck might seem small, even harmless, but can actually be the body's way of raising a quiet alarm. And when you've been on this earth for 60 or 70 plus years, you know your body better than anyone. You can feel it when something isn't right, even if it's subtle. That inner voice, it matters, and sometimes it's worth listening to more closely than ever. Let's keep going because there are still signs that can be just as sneaky, signs that many folks chalk up to aging, allergies, or stress, but that actually deserve a closer look. One of them is something you might not connect to cancer right away: frequent nosebleeds, or bloody mucus. Now I get it, dry air, high blood pressure, or even picking your nose too much can all cause a little bleeding now and then. That's normal. But if you're noticing blood when you blow your nose more than just once or twice, if it's becoming a regular thing, or if the mucus coming out has streaks of red in it often, that's not something you should ignore. See, when a tumor forms in the nasopharynx, it can cause irritation in the tiny blood vessels that line that area. Those vessels can break easily, leading to what might seem like just a little nosebleed. And because this area is tucked behind your nose, you may not even realize it's coming from there. You just see the blood and move on. But if it keeps happening, it's time to pause. Don't just grab a tissue and forget it. Tell your doctor. That little streak might be the clue that gets you the early diagnosis you need. Another sign that often flies under the radar is a persistent sore throat, or feeling of something stuck in the throat. I want you to think about the last time you had a sore throat, maybe from a cold or talking too much. It probably came and went in a few days. But with nasopharyngeal cancer, it's not quite the same. This isn't the type of sore throat that comes with a fever or coughing fits. Instead, it can feel more like a constant tickle, or like something is pressing from the inside. Some people describe it as a lump that just won't go down, no matter how much water they drink. One of my patients, Susan, she was 66 at the time, came in because she kept clearing her throat. She thought maybe she was developing acid reflux, but when we took a closer look and did a nasal scope, we found the real cause. She never imagined something like nasopharyngeal cancer would show up that way. But it did, and because she followed her gut and spoke up, we found it early. That's what saved her. So if your throat feels off, not once or twice, but over several weeks, listen to that feeling. Don't try to power through it or blame it on postnasal drip. If it's not going away, it needs attention. Now here's another one that might surprise you: changes in vision or eye movement. That's right, your eyes can be affected by a cancer that starts way up in your throat, behind the nose. How does that happen? Well, the nasopharynx sits close to several important nerves, including those that control how your eyes move and how clearly you see. If a tumor grows in the wrong direction, it can start pressing on those nerves. You might notice double vision, or maybe your eye starts turning slightly inward or outward without you realizing it. Some people feel pressure behind the eye, or they might notice one eyelid drooping more than the other. It's subtle, but it's real. You might be thinking, well, I already wear glasses, and my vision isn't what it used to be anyway. And that's completely normal. But if the change comes on quickly, or affects only one eye, or is accompanied by headaches or that out-ear pressure we talked about earlier, don't chalk it up to aging. Call your doctor. That's the kind of change that's worth investigating. And since I mentioned it, let's talk about headaches for a moment. I'm not talking about the kind of headaches you get from missing your morning coffee or from staring at a screen too long. I'm talking about persistent, localized headaches, especially behind the eyes or deep within the skull, that don't go away with Tylenol or rest. The nasopharynx is in a tight, crowded part of the head. As a tumor grows, even slowly, it can put pressure on the base of the skull, leading to unusual pain patterns. What makes this type of headache different is that it's not generalized. It tends to be one-sided, deep, and consistent over time. Let's face it, at 60, 70, or 80 years old, many of us have aches and pains. But you know your pain. You know what's new. And a headache that keeps returning, that's focused behind one eye or in one spot, that's a signal, especially if it comes with any of these other signs. I want you to hear me clearly here. I'm not trying to scare you. I'm trying to empower you. Because the truth is, catching something early gives you power. It gives you choices. It gives you life. Too many people shrug off these symptoms because they don't want to be a burden, or because they're afraid to hear bad news. But knowledge isn't the enemy. Silence is. And you are not a burden, not to your doctor, not to your family, and certainly not to me. If you're experiencing more than one of these symptoms, or even if it's just one, but it's persistent and strange, please talk about it. Talk to someone you trust. Talk to your physician. Or talk to me in the comments. I want this to be a safe place for conversation and care. Tell me, have you noticed any vision changes? A headache that lingers? A sore throat that doesn't feel like the usual cold? Your voice matters, and your story might just help someone else speak up, too. Let's keep this conversation going, because we're not done yet. There are still a few more signs you deserve to know about, and one in particular that surprises a lot of people. Now, I want to thank you for staying with me so far. We've talked about some of the subtle, easily overlooked signs like pressure in the ear, swollen lymph nodes, nosebleeds, and changes in your vision that might not set off alarm bells at first, but really do deserve your attention. You're here because you care about your health or the health of someone you love, and that means something. It means you're taking steps, even small ones, to stay ahead. And that's what this is all about: awareness, not fear. Let's continue, because there's still more that your body might be trying to tell you. Here's one that really catches people off guard: facial numbness or tingling. I want you to imagine this: you're brushing your teeth, and you suddenly notice your cheek feels different. Maybe a little numb. Maybe tingly, like when your foot falls asleep. Or perhaps you touch your upper lip and it doesn't feel quite right. Most people brush it off. They think maybe they slept on their side wrong or pinched a nerve somehow. And sometimes, sure, that's all it is. But when that numbness keeps coming back, or worse, never really goes away, that's something else entirely. The nerves in your face are incredibly delicate, and they pass through narrow spaces near your sinuses and the nasopharynx. If a tumor is putting pressure on those nerves, you may start to lose sensation, first in small patches, then more broadly. A man I treated years ago, Jim, he was 72, told me he first noticed it when shaving. He said the razor didn't feel sharp on the left side of his face. It wasn't pain, it was the absence of feeling. That stuck with me, because it wasn't the kind of symptom that screams serious illness. But it was, and we were able to act quickly because he didn't ignore it. So if something doesn't feel right, literally don't wait to speak up. Numbness, tingling, or even a sensation of tightness in your cheek, jaw, or lip might just be your body's early whisper that it needs help. Another important sign we need to talk about is difficulty speaking or swallowing. Now, we all know that as we age, it's not unusual to clear our throat more often, or to occasionally feel like food went down the wrong pipe. That's normal. But when you start to feel like you're struggling to swallow more frequently, especially soft foods or liquids, that's not just getting older. Some people describe it as food sticking in their throat. Others feel like they have to swallow several times to get something down. And when the cancer starts affecting nearby nerves or muscles, it can even cause your voice to change, becoming hoarse, nasal, or weak. You might also start slurring your words just a little, or find that speaking clearly takes more effort than it used to. These changes can be incredibly gradual, which is why so many people miss them. But let me tell you, if something about your speech or swallowing feels off, Your doctor needs to hear about it. There's one more sign I want to share with you, and this one can be the most confusing of all, because it mimics something we usually associate with something completely different: hearing loss, especially in one ear. You'd be amazed how many people in their 60s and 70s assume that hearing loss is just part of aging. And yes, our hearing can absolutely fade over time. But here's what's different. Nasopharyngeal cancer can block the opening to your eustachian tube, the small canal that connects your middle ear to the back of your nose and throat. When that tube is blocked, fluid builds up behind the eardrum, and it becomes harder for sound to travel. You might not even notice it at first. Maybe you keep turning the TV up, or people sound like they're mumbling more often. But here's the red flag. It only happens in one ear. That's not normal aging. That's a possible sign that something is physically pressing on one side of your head, and that needs immediate attention. If you ever find yourself saying, hum more than once, or cupping one ear to hear better, don't just assume you need a hearing aid. Let someone take a look inside that ear and check what's really going on. It might be something simple, like wax buildup or an ear infection, but it might be something more. And wouldn't you rather know early, while it's still small and manageable? So let's take a deep breath here. We've covered a lot. These symptoms, whether it's that persistent ear pressure, the unexplained nosebleeds, numbness, vision issues, voice changes, trouble swallowing, or hearing loss, might show up one at a time, or two or three together. They might come and go. But the key is this: when something doesn't go away, when it lingers or keeps coming back, that's the moment to act. I want you to remember something really important. You are not being dramatic for bringing up these concerns. You are not wasting anyone's time. You are doing exactly what someone wise and experienced would do. You are advocating for your own well-being, and that's a strength, not a weakness. Your age isn't a liability, it's a superpower. You've lived through ups and downs, joy and loss. You've felt what it's like to be well, and what it feels like when something's off. You've earned the right to listen to that voice inside you and to act when it whispers that something's not quite right. And if you're not sure what to say to your doctor, just be honest. Say, I've been having a few symptoms that don't feel like me. That's enough to start the conversation. That's how healing begins. Before we wrap this up, I'd love to hear from you. Have you ever experienced one of these signs? Maybe a nosebleed that didn't make sense, or trouble swallowing that you brushed off? Let's talk about it in the comments. I read every one, and I'm here to support you. If this video spoke to you, or made you think of someone in your life who might need to hear it, please share it with them. Hit the like button, and subscribe if you want more real conversations about staying healthy and strong at any age. And above all, know this: your health matters. You matter. Early detection can make all the difference, and your story could be the one that changes someone else's life. So here's to living wisely, listening closely, and speaking up when it counts. You've got this, and you're not alone.